This is Miriam Tucker reporting from the annual meeting of the Society for Academic Emergency Medicine.
The way we decided to do this was by the use of medical directives. Medical directives are a pathway in which patient care can be initiated prior to physician assessment. This has been commonly used before with regards to use of bronchodilator therapy. It has not yet been studied, though, in the use of oral corticosteroids. The reason we felt this is important is that we know, based on prior research, that the timing of oral corticosteroids is most important in the sense that the risk of future admission is directly related to the receipt of steroids as soon as possible. We developed this new medical directive with collaboration from pharmacy and administrators, and it allowed for the triage nurse to administer oral corticosteroids prior to physician assessment. To evaluate to see if this was effective, we designed it a before or after trial, and what our study found was in a 4-month before period compared to a 4-month after period, that many of the outcomes that are most important to the physicians and physicians in the emergency department and to the healthcare overcrowding in general, this intervention was very successful. For example, our primary outcome was to see, do children improve more quickly if they get their steroid at triage as compared to our old way of doing it? They do. In fact, they improve on average about 28 minutes sooner. Second, we found that children were much less likely to be admitted to hospital if they received steroids at triage. We found a reduction of admission went from 19% down to less than 12%. Next, we found that children received their steroids 44 minutes sooner, which is even more important in the fact that children actually left than the emergency room 44 minutes sooner. So it was almost a minute per minute savings of time in the emergency room. While 44 minutes may seem short, when you add that over thousands of visits per year at most pediatric tertiary centers, you're talking of thousands of hours of time saved, of nursing time, physician time, bed space, and as well the money saved for possible admission. If adopted broadly, this sort of intervention could have large healthcare implications with regards to reducing the burden of asthma and as a potential solution to overcrowding in our emergency rooms.
This is Miriam Tucker reporting from Boston.